Hello, so this is the benefits of moving after surgery. Benefits of moving. Lack of movement after surgery may lead to cardiovascular problems, a drop in blood pressure when moving from lying or sitting to standing, increased workload on the heart, increased risk of blood clots, respiratory problems, decreased lung expansion, pooled secretions, an imbalance of oxygen and carbon dioxide levels, gastrointestinal, indigestion, constipation, a change in appetite, urine pools in the back of the kidneys, which cause an increase in risk infection, metabolic equilibrium, lowered metabolism, weakened muscles, fluids and body salt imbalance, changes in sleep patterns, psychosocial equilibrium, increased dependence on others and activities, and innate social interactions, increased likelihood of seeing yourself as sick, pain, muscle stiffness and weakness, and painful pressure ulcers. What can I do to help with my recovery? Do warm-up exercises. Avoid a sudden drop in blood pressure that can make you feel dizzy when you stand. Avoid a sudden increase in heart rate that can be a response to a sudden drop in blood pressure. Lower the sudden increase in workload on the heart. Avoid forcing the muscles to work without oxygen. Prevent the frozen shoulder some patients experience, thinking we really mean don't move or use your arms. Do shoulder rolls, shoulder width, overhead arm raises. Do not push, pull, or spread eagle the arms.
Splinted coughing. In a sitting position, support the operated area with your hands while coughing and try to remove the sputum. Upper limb exercises. In sitting position, raise your hand over your head as far as possible, keeping your elbows straight, and lower it down. Repeat 10 times. Raise your hand away from your body until the upper arm touches your ear and lower it down. Repeat 10 times. Elbow. In a sitting position, bend your elbow up to shoulder level and straighten back. Repeat 10 times. Fist. In a sitting position, make a fist and open it. Repeat 10 times. Move your wrist up and down. Repeat 10 times. Trunk rotations. In a sitting position, fold your hands and turn to both sides for a comfortable stretch. Repeat 10 times. Shoulder rotations. In a sitting position, place your fingertips on your shoulder and rotate the arm clockwise and then anti-clockwise. Repeat 10 times. Ladder exercises. In a standing position, stand facing a wall and walk your fingers up slowly. Repeat 10 times. Stand sideways to the wall and walk your fingers up slowly. Repeat 10 times.
So this exercise is called shoulder circles. You'll be focusing on gentle mobility and movement of the shoulder blade area. So you're sitting in a chair with your feet comfortably on the floor, good upright posture, chin and head in a very neutral position. So with this exercise, you'll have your arms relaxed in your lap or side. Roll your shoulders forward, rounding, bringing them up towards your ears, back together in the back, and finishing with them down and relaxed. And you could repeat that same circle 5 to 10 times slowly. Good. You're doing a nice job keeping your head in line with your body. And if it feels good, you could repeat the process going the other direction, always ending up in a down and relaxed position. Great. Looks good.
Hey everybody, this is Matt Hsu with Kristen here at Upright Health, and we are continuing movement tutorials for medical professionals. Today we are looking at the forward arm raise, so we're just going to have Kristen show you this wonderful example of a forward arm raise. She just brings her hands forward in an arc all the way up above her head. You'll notice that her humerus lines up with her ear, she's got perfectly vertical arms, and she's doing that without any other compensations. A lot of times with clients we see here, and probably for you with patients that you see with shoulder issues, there are two major faults that happen with this movement. First of all is the shoulder shrugging. So Kristen is showing you what happens. The shoulder blades are a little bit protracted and they're a little bit shrugged, and what that means is the clearance for the humerus in the glenoid fossa is reduced, and you'll probably run the humerus or some other piece of soft tissue into the acromion process or something else. So a lot of times people complain about anterior deltoid or medial deltoid pain with doing this. So this can be a strength and or a coordination issue. If it's a coordination issue, then cueing your patient to relax in the top of their shoulders, so relaxing in the upper traps and then the levator, this whole area can help move through that motion better. The other thing that you can do, if you go ahead and face this way, is try to get them to pull the shoulder blades a little bit down and back and then raise the hands up, and then that might be enough to help cue that so this doesn't get over engaged. The other thing that you might see is a tightness issue. So as Kristen comes up, she's trying to get her hands up, but you'll notice here that her arms actually relative to her rib cage are not as vertical as they're supposed to be. She's actually tilted her whole rib cage and gotten hyperlordotic in order to get her arms vertical. So this, so you can see again right here, this is often an issue with tightness. It could also be a strength and coordination thing, but a lot of times it's an issue with tightness. So when you see either of these situations, it's a good idea to stretch out the lats. So the lats actually attach from the lower back, and then they go up kind of through the armpit and up to the front of the humerus, right? So it's going to attach right up here. It comes up like that, comes up from the back and up to the front here. So when it gets tight, it makes it very, very hard to raise your arm up. It's literally the most obvious restrictor of this motion. So to do a lat stretch, what you can do is just use like a tabletop, where we're going to use the bench here, and you can just come down, have your patient come down onto the bench with your hand or onto the examination table that you have, and you're just going to have them pull, so like they're trying to get a stretch through the armpit. So we're going to have Kristen do this here. She's just going to bend forward. She's going to have her hand on the bench, so she's got some traction. She's taking a step back with her right foot, and then she's getting this stretch all the way along the rib cage and then down this way. She wants to feel this stretch up near the armpit and up near that shoulder blade. And by pulling this right hip away from the right armpit, she's able to get more of a stretch. Another variation of this is to do the same thing but with the palm up, and that actually helps get the lat in a little more of a stretch position. So she's just going to have palm up and then just out like that, pulling the hip back, and again looking for a stretch right along the route that the lat attaches on. So you could do this on a table, you could do this on your exam table, do it on a bench, you could do it with a foam roller. There's many ways to do that. The other thing you want to do is scapular retractions. So that's something that we've talked about many times in this movement tutorial series. And that's, again, just practicing moving the shoulder blades back, retracting them without using the shoulder blade elevators, right? So levator scap or upper traps, we need to try to cut those out so we don't get that shrugging, and so that we're able to use the rhomboids and middle traps more. So hopefully that gives you some good ideas in case you have patients that you see who have trouble getting the forward arm raise, and I hope that you remember that pain sucks.
Life should.
You can relieve tension in your neck and shoulders by performing neck and shoulder rolls. Start by sitting up straight with your shoulders relaxed and your hands resting on your lap. Take a deep breath, and as you exhale, let your head drop forward. As you inhale, roll your head up to the left, and exhale as you let your left ear gently drop towards your left shoulder. Make sure your shoulders are relaxed and take a few breaths while you hold this position. Then inhale as you roll your head back down to the center, and exhale as you roll your neck to the right so your right ear gently drops towards your right shoulder. Make sure your shoulders are still relaxed and take a few breaths in this position. It's a good idea to pause this video now and do 5 to 10 of these neck rolls to relieve tension. For shoulder rolls, keep your back straight with your head facing forwards and your arms relaxed by your sides. Roll both of your shoulders forward 5 times, taking calm and steady breaths. Make sure you keep your neck and arms relaxed. Once you've completed 5 shoulder rolls, go in the opposite direction and roll your shoulders back 5 times.
Hi, I'm Jenny from SOAS Massage and Bodywork here with your weekly quick tip. Today we're going to be doing a simple shoulder shrug, and this is for everyone. When you're sitting at your desk, your shoulders start to kind of creep up, and when you're cycling, that same thing happens. Even when you're running, that happens, and with a lot of other sports and activities as well. So another thing that happens is our breath gets a little bit more shallow and we breathe shorter breaths. So we're just going to take a nice deep breath and raise our shoulders up as you're inhaling, and squeeze the upper back and shoulder muscles, and then with a deep exhale, let it relax. Again, just breathe in, squeezing those traps, and relax. And do it like 5 to 10 times, and use it as a way to just break up the repetitive motion of holding everything tight and releasing your shoulders. Try it once a day for a week and see if you notice any change. Again, I'm Jenny from SOAS Massage and Bodywork. Thanks.
In a lying position, bend your leg and straighten. Repeat 10 times. Move your legs sideways, out, and in, keeping your knees straight, and take it back. Repeat 10 times. Move your foot up and down in a sitting or lying position. Precautions to be followed after surgery. Number 1. Walk frequently, at least 5 times in a day before taking food or after 1 hour of taking food. Number 2. Every week, increase the time of your walk by 5 minutes. If you feel any breathlessness or chest pain while walking, please consult the doctor immediately. Number 3. Spirometry exercise should be done every hour regularly for 2 months. Do not use your chest belt while doing spirometer and deep breathing exercises. Number 4. Wear stockings on and off regularly for 3 months. Number 5. Keep the legs in an elevated position by placing a pillow under your ankles. Number 6. Avoid lifting weights and driving vehicles for 3 months. Number 7. While getting up from bed, turn to one side and put your legs down. And then take weight on the hand and get up. Or take someone's help for 1 month. Later on, this can be done independently. Number 8. Wear your chest belt while doing exercises, walking, and traveling. Number 9. Do not put more pressure while passing motion.